Hello, my name is Abraham Gallegos, and I am a student in the dental hygiene program at UPBC, El Paso Community College. And the purpose of this video is to provide information about embrasure types and interdental aids. So first of all, what are embrasures? Well, to know that, you must know what gingiva is, which is basically your gums. Your gums not only appear on top like you see here, but they fill the space in between each tooth, if you have noticed. Um, the area between each tooth is called the interproximal space, and usually if you have healthy gingiva, that interproximal space will be filled with gum. The purpose of the gum in between your tooth is for that food or any type of food debris can get stuck in between each tooth, so it gets worn off out of there. So the embrasure, that's what an embrasure is. There's three classifications. The first type of embrasure, which is the healthy one, is the gums basically fill up the interproximal space. They fill up the area in between your teeth, which, like I said before, is to wipe away the food debris that could get stuck in there. There's type 2 classification as well. It's a type 2 embrasure. Usually it's the 75% of the gingiva or gum fills up that interproximal space in between your teeth. This can be caused due to gingivitis, periodontitis, which is bone and gingival destruction of your gums, basically, and the alveolar bone is what supports your teeth. And usually when you have these types of diseases, it causes for the gums to recede. And due to this, there's gaps in between your teeth that get formed, so that means that bacteria or food debris can easily be caught in between those spaces. So there's also another classification, which would be type 3 embrasure, which is when the gums have receded 50% or even less than that, or more than that, I do apologize. So they no longer fill the interproximal space. So food debris or bacteria or plaque can easily be stuck in there, in those areas, and can cause tissue destruction and cause gingivitis and, like I said, periodontitis. But thankfully, there's interdental aids that can help us remove that plaque or bacteria that can get stuck in between your teeth. So the most common one would be dental floss. Usually it's most effective in the embrasure type 1 because the gums fills the interproximal space. So the slimmest interdental aid that can go in between there would be dental floss. And well, the way you use floss, just grab a good amount of floss, wrap it around your fingers, and go in between each tooth. Go up and down. Wrap it around the side of the tooth. Go up and down. Do not go as a saw motion because this can cut your gums and it could cause irritation. But this would be one of the most effective ways to remove any type of bacteria or plaque when you have a type 1 embrasure. You can also use a floss toothpick, which most people like this type of interdental aid better compared to floss because you can easily handle it in between each tooth and you can easily maneuver it in your mouth, and it can go in between each tooth and in between your gum area and it can remove all that debris if there is any. It can easily be used in all type of embrasures, in type 1, type 2, or type 3, both the floss and the floss toothpick. But if you have a type 2 embrasure, you can easily get a toothpick, and this one is pretty good because it has a little brush at one end and an actual plastic toothpick in the other, and can go between each tooth and basically remove any food debris that you have there, usually large pieces like kettle corn or pieces of chips that you might get lodged in there. And it's particularly useful for type 2 or type 3 embrasures because you have that gap in between that tooth, and you can easily insert the toothpick and dislodge any debris in there. Another suggestion, and it's common in ortho patients, which meaning people who have braces, it's the interdental brush. The interdental brush can easily be used for type 2 if allowed to go in between the tooth, or a type 3 because there's no gum in between each tooth. So you would just insert the brush in between the area and clean as good as possible. And this, like I said, this is specifically useful for type 3 or type 2 embrasures if the brush is allowed to go in between the tooth. You can also use it for your braces, going between the bracket areas and clean all the debris in there. And finally, we have this homemade tufted brush. This one is mainly used for type 3 embrasures because you can easily insert the bristles in between each tooth and remove all the debris. It's specifically used for type 3 because there is no gums in there. The gums have receded basically in that interproximal space, so you can easily remove the food. So you can buy one at a retail store, or you can make one yourself. I made this one by myself actually. I just cut part of the bristles and left a tuft right there. So yes, I hope this explanation of interdental aids and embrasures helped you. If you need any more help, you can easily call your dentist or refer to any online sources such as dentalcare.com. And thank you for watching.